You created a 3-pillar approach to this. Can you go into that, what those pillars are?
Yeah, this is the 3 pillars, Dr. Rao's 3 pillars of biological medicine. You know, I was in the last 30 years, we had so many patients when I left the old clinic, which I built up over 30 years. Then we had, our patient number was 88,000. So the last patient number, more or less around this. So we had a huge experience over 30 years. And well, I was not the only, at the best time, we were 10 doctors. But what we found in our root cause approach, we found in most patients, we have 3 pillars. Pillar number 1 is the toxicity. People are so extremely toxic nowadays.
Right.
From food, from environment, from agricultural pesticides, and so on. And we use techniques to find these toxins. For example, only a little example, in breast cancer, we always find a heavy metal toxicity. Always. It's either it is mercury, cadmium is also very problematic, or we find a organic toxins, perfluorooctanic acid, which is a textile product which you need in tissues and so on. These kind of toxins which come into the body. And the barrel of toxicity just builds up until it overflows. Then the patients come to us. But we always find this barrel full. Pillar number 1, toxicity. And very often in 40% of the American, there are statistics. Well, we are very scientific also, but on a better level. In 40% of our American cancer patients, we find a genetic deficiency in detoxification. The body can't detoxify. So in these persons, the mercury load, the cadmium load, the lead load, the DDT load, the glyphosate load, they just increase until it gets epigenetic and the cancer begins. So this is a toxic influence which makes, well, if you do not detoxify these patients and only remove, for example, the breast cancer, which orthodox medicine does, then it will come again, either in metastases or on the other side, because the root cause is not removed. So this is number 1. Number 2, my colleague, the guy in Salzburg, which became a good friend and really my mentor and my teacher, he said, cancer is an intestinal disease, always, he said. Well, cancer is an intestinal disease, but he passed away. Dear friend Conrad, I have to say you were right. This is fantastic. You were right. I see this in every patient. Why? Because our immune system is laying in the gut. It's 80% of the T lymph cells, or the natural killer cells, or even macrophages. They are in the intestines. And if your intestine is a wreck, if you eat wrong during decades, they get the immune system, the intestinal immune system gets less and less and less until it's no more enough around. And then these T cells, these macrophages, the grenadiers who should go and shoot cancer cells, they are no more active. They are just no more around. So we have to build up the intestinal system And by doing so, the intestinal immune system, which is 90% of the whole lymphatic system. So pillar number 2 is the upbuilding of the intestines, change of diet, increase of lymphatic system, and so on. This is pillar number 2. And now something, it's incredible, simple what I say now. The body comes, the patient comes to look at my patients. I only have the worst patients. They come, doctor, how can you do something? I have been everywhere. I have cancer stage 4, or I have hepatitis C, or I have autoimmune disease. Nothing works anymore. Then they come to me. Well, I don't like to say this word, but it's health wrecks. Mm-hmm. And so they come to us and we have to upbuild. It's not only about their cancer, it's about their body. Mm-hmm. And in Orthodox medicine, nobody builds up the rest of the body. They treat against the cancer, which makes the body even weaker, and nobody builds up. And so in all these degenerative diseases, in all neurological diseases, especially brain diseases, we have fantastic results on Parkinson's and on beginning dementia, because nobody builds up. They only do anti-treatment, but never pro-treatment. And our third pillar is the pro-pillar. Mm-hmm. We just fortify the body of these poor patients who come in a very bad all over situation. And then the healthier the body is, the less cancer or autoimmune or degeneration can work. It's like in a state, the healthier the state is, the less you will get terrorists.
Right. And that's so much of what medicine misses, is this idea that if you change the environment, allow the body to do what it always does, which is regulate and self-heal, it will start to correct. Whereas most of medicine says your body is broken, you require surgery or pharmaceutical intervention for the rest of your life because it'll always be broken. Whereas I know your approach is much saying the body isn't broken, it just needs the right environment and the right pieces, again, to do what it does best, heal and regenerate.